Hello. Can you
Okay,
hear me?
I can hear you fine. Okay, everyone, thank you so much for your patience. Technology is still a challenge in 2020. But for those of you just joining, my name is Jill Swing. I'm the president and founder of SC Compassionate Care Alliance, and we are an organization that provides information and education about medical cannabis and medical cannabis advocacy. We are fortunate to have joining with me today in a brief discussion Dr. Robert Malcolm from MUSC Department of Psychiatry. He is a professor of psychiatry and associate dean for continuing medical education at MUSC. He's also been a clinical pharmacology researcher for over 35 years. And so I'm thrilled to have Dr. Malcolm here. I'll let him do a brief introduction, and then what we will be discussing mostly today is the CBD conference that MUSC is hosting a week from today, next Friday, October 2nd, from 1 to 4:30 in the afternoon. So Dr. Malcolm, thank you so much for your patience with all the technology issues, and thank you for joining us. I gave a brief introduction, so can you tell us just a little bit more about yourself, and then we'll start talking a little bit about your topic as a presenter at the CBD conference.
Well, thank you for having me, Jill. It's a pleasure to be here with you today, and I'm very excited about our conference next week, and I hope we can draw in a lot of people for that conference from various healthcare disciplines, because I think the conference is going to appeal to a lot of people. A little bit about me. I work for the Medical University of South Carolina. I'm a professor of psychiatry, family medicine, and pediatrics. I also head up the continuing education division for the College of Medicine at the university. And as you said, I've been engaged in clinical research development of new medications for over 35 years. And I've worked in the areas of schizophrenia, depression, anxiety, drug addiction, and I've done some research with CBD. And next Friday, I plan to talk about not only CBD research at MUSC, but some other CBD research around the country that just briefly mention what's going on. And then, forgive me, but I'm going to talk about my personal experiences with arthritis with CBD. And it's been very positive. And I think this is one of those things that's readily available to all of us without prescription. It's relatively inexpensive, it's safe, and above all, it's effective. And I'm mainly going to be talking about the topical use of CBD for osteoarthritis, which I'm plagued with, but thanks to CBD, I can really get rapid relief in a very safe and effective way. Last night being a good example, I was doing some yard work and I hit my hand here, and it was pretty painful. And normally in the old days, I would have run inside and take a couple of non-steroidal medicines, but instead I took some of my CBD cream, and amazingly within 20 minutes, my arthritic pain had subsided. The throbbing was going away. And so it's very effective for a number of things. Now, it's not only a great topical anti-inflammatory drug, it can be used for many other things, as you know, too. It's marketed for intractable seizures in children. It has anti-anxiety properties and so forth. I don't know where you want to go from here, Jill, but you just take it away and I'll try to do my best.
Sure. Well, I do have a question for you specifically, since you brought up your personal story. And obviously, I come at this with a personal story as well.
Yeah.
And I don't know if our viewers know much of my history, but I have a daughter with severe intractable epilepsy. And in 2013, I saw that Sanjay Gupta story about the little girl in Colorado who the parents were giving her a cannabis oil that was very low in THC but high in this additional cannabinoid, cannabis derivative, cannabidiol, which nobody had really even heard much about until that point, CBD. And so I worked with the legislature in getting a bill passed to allow the possession of CBD in the state because it was illegal as a derivative of marijuana, both on the federal level and the state level. And so that was sort of my original history with that. But one of the things that I've run into as I've learned more and as I've advocated for the use of all cannabinoids, not just CBD, is this concern that there's not enough research and that, it's anecdotal. And, you using your own personal story, it just made me think, are doctors taking the anecdotal evidence a little more seriously, or are they still looking for that gold standard double-blind placebo study, which is, as you know, very difficult to do using cannabis?
Well, I think doctors have had more experience, both personally and with patients, with CBD, also known as cannabidiol. And so I think it's being more widely accepted. But the truth is, if you want approval by the Food and Drug Administration, you're going to have to do several double-blind studies involving several hundred people over several years. And that's going to cost a lot of money. That could be upwards of $250 to $500 million. So I think the kind of studies we would like to see are expensive, and some are forthcoming and some are not. I just heard of an interesting study starting at MUSC in January where cannabidiol is going to be used to treat opioid addiction. And that is going to be a double-blind study running over 4 to 5 years. So it's going to take us a while to get the results of that study. But opioid addiction is a severe epidemic in the United States that kills thousands of people, about 30,000 people a year, and has massive effects in families' lives. And if cannabidiol is effective, CBD, for that, it will be a major, major breakthrough. So double-blind studies are an important part of what we do, but anecdotal things are important too. And let me tell you one anecdotal study that I'll elaborate on next week, but I have a good friend whose wife suffers from a severe facial pain syndrome. They don't really know the cause of that, but she had been on opiates. She had been on non-steroidal drugs like Advil and stronger drugs, and just was suffering massively. And he and I had talked a while back about CBD cream to put on the facial nerve. And he's a retired physician, and he was a little skeptical of my endorsement, but she started using it. I recommended a well-known brand that's made locally, and he put that on her, and within less than 4 hours, her pain was completely relieved in her facial nerve.
Wow.
It was miraculous, and they are now believers in CBD. So that just goes to show. And she'd been through the gamut of prescription medications, which had done her very little good and some harm, actually, at least temporarily. So, I think those kind of anecdotal stories can be very powerful.
And I've reached to the point where I kind of cringe when I hear that word, because obviously this is so universal now, and especially hemp-derived CBD being federally legal now. That, and so many people, like you said, have access. So it's almost beyond anecdotal, and we've moved on to this, what I like to use the terminology, overwhelming human evidence, that you can't just look past and ignore. Okay, we may not have the double-blind placebo studies, but like you said, those cost millions of dollars, and they're very, my understanding of how those work. Like we took my daughter to New York to get in the original CBD study for Epidiolex. And she didn't qualify, even though she had very severe uncontrolled seizures, hundreds a day. But because she didn't have a specific genetic malformation, diagnosis of Dravet syndrome or of Lennox-Gastaut, and that I think originally is Dravet only.
Right.
She did not qualify for that study. So, so the challenge is that in the research, it's so specific that you would have to take CBD and study it for every single condition. You can't universally say CBD is medicine. You can't universally say, I get all these lawmakers that say, well, until the FDA says it's medicine, I don't say it's medicine. But they can't universally say marijuana is medicine. It's so much more specific than that. So can you touch briefly on some of or I guess you talked about the CBD for opioids. Is that the research you were referring to earlier that you guys are going to be doing there at MUSC?
Yes, that's a different study. Now, we have already completed a study. Unfortunately, it was not a positive study, but we looked at CBD a couple of years ago as a possible treatment for marijuana abuse. And it didn't do anything harmful to people who were using excessive marijuana, but it really didn't slow it down either. So that was a bit disappointing. But we think with opioids, because of the chemical pathways involved, that it may be more useful for opioid dependence. I'll tell you another personal human experience story. I'm not paraphrasing you exactly, but we've been doing these marijuana CBD conferences now for several years. And the first year we did the conference, there was a display out in the lobby by a local CBD manufacturer. And at that point, I was having some trouble with my left ankle, still do periodically. And they were not allowed to sell the product, but they were giving away samples. So I took a sample and I rubbed it on my left ankle, and I got back to the office and I realized about 2 hours later that my left ankle was no longer bothering me. And I thought, well, maybe that's a placebo effect. And I said, I'll go out and I'll go to a store and I'll buy some CBD cream. I unfortunately bought a different brand. I put it on my ankle a few days later and nothing happened. Mm-hmm. And I was lucky enough to get the original brand, buy some that I had used as a sample earlier at the conference. And lo and behold, it worked in less than an hour.
Wow.
So to me, that's very convincing evidence. Mm-hmm. And it's I'm a sample of one, but to me, it works, and I use it regularly on my arthritic hands and on my left ankle. Mm-hmm. I have to say, as a disclaimer, on larger joints, I don't get a lot of relief, but I think that's because I would have to use a lot of CBD cream to do that. So but it doesn't work as well on, say, a knee as it does in an ankle or fingers, for that matter.
Okay. Well, and, this gets a little bit off the topic of the conference, but now I'm just curious now that we're talking about this, but when you brought up, you had one product that you found success and another you did not, there is some merit to the FDA approval of products and the oversight of certain products, because as a parent with a disabled child, very early on when we were accessing CBD, we were getting it off of the black market. We couldn't go to the grocery store or the gas station and buy it. And so we never really knew what we were getting. So there is some merit. I know that there are a lot of manufacturers and a lot of purists out there that don't really like this concept of government control and regulation. However, from a consumer standpoint, it is important. I know that the FDA over the years has sent letters to companies. They've tested their products and they advertise that they have a certain amount of CBD per, so many milligrams per whatever unit. And that information isn't always accurate. And so from a consumer protection standpoint, I think the oversight is important. I don't know if you want to just speak to that at all, or it's just something that, triggered my thought process, because so many people say, well, it's out there, it's everywhere, but how do I know I'm getting something that's, even physicians are a little leery of recommending it because they say, well, it's not controlled, it's not consistent. Is there an answer, or are we just we're still, even though this has been around for a few years, I guess we're still kind of in the infancy as far as the regulation side of it?
Well, over-the-counter medications do not have as high a level of oversight by the federal government as prescription medicines do, as you've pointed out. So I think there are certain guidelines that one needs to follow. First of all, I think if you have a company that is local and respected, they're trying to maintain a reputation with local members of the community. So I think you can pretty well rest assured that those type of products are often pretty good. The other thing is their national name brands of CBD products, and those products are going to be pretty good for the same reason, because they're appealing to a wide audience and they're trying to maintain their reputation. I think if you have found a product that the price is too good to be true, it's probably not true. Mm-hmm. And you have to be careful of that. The other thing I would say, though, that if you're, let's say, using a product topically for a condition that involves inflammation, which is, it's been proven that CBD is a good anti-inflammatory product, or a great anti-inflammatory product, better than many other things. And our conference next week deals with some of that in detail. Then you can try a small amount of one brand in one area of inflammation, and then maybe a few days later, try a different brand and compare them and just see what the outcome is. And I think you'll be amazed sometime that one product may be superior to another. Alternatively, if you have inflammation on one extremity and on the other extremity, you can try the two different products on one, and you can do your own self-comparison. So that is pretty scientific, actually, to do that. You're a study of one, but you have a way to do that either over time or on different extremities. So another thing, though, that turns out to be kind of expensive, although not as expensive as you think, is that you can send off to various private commercial labs who can analyze the percentage of CBD per milligram in any product, whether it be a liquid product or an oil, or whether it be a cream, and you can find out the content. So there are various ways, I think, that we, as consumers, can determine the purity and the effectiveness of a product, and all of those are possibilities. The FDA is only going to study a product when they get a lot of signals or complaints from consumers, and then they themselves will analyze an over-the-counter product.
Okay. All right. Well, that's good information. And just to share another anecdotal story, I have one of my own, actually. Like I said, when we were first accessing CBD back in 2014, 2015, it was a challenge. But I had a frozen shoulder and had been prescribed anti-inflammatory medications by my physician, did 6 months of physical therapy with only minor success in range of motion. I was kind of, washing my hair like this, and I could barely get my hand in my pocket.
Yeah.
So it was a pretty, there's just no range of motion in my shoulder. And of course I have this disabled child that I have to lift quite often. So that just made it a challenge. And I suffered, I don't know, like a year and a half at least from that. And we got to the point where we had a reliable source of CBD. And I was like, well, it's supposed to be a powerful anti-inflammatory. And the doctor did prescribe an anti-inflammatory. for my shoulder, I'm just going to try it. So I got up on a Saturday morning, took a syringe full, which was about 10 milligrams, if I recall correctly, and didn't think anything of it, like you with your ankle, you did. And I went to reach for a glass out of the cupboard, and I raised my arm, and it was like I'd been doing it the whole time. And I was like, wait a minute, I just did that. And I hadn't been able to do that literally for months. So, there is, like I said, overwhelming human evidence is what I like to use, but it's a fascinating topic. And I think that it's been out a while, but there's still a lot of unanswered questions. And so I'm really grateful to MUSC for taking it up. I would like to just give a quick overview. Like I said, that is a virtual conference, and we will be sharing out the link to register for that conference. Let's see, Dr. Malcolm, do you want me to go over the list of speakers, or do you?
Yeah, why don't you go and list the speakers and just give their title of their presentation, and then I can chime in after you've chime in after you have given them and say a few words about the speakers.
Sure. Okay. So this is a half-day conference. So it's in the afternoon, starting at 1 o'clock in the afternoon next Friday, a week from today. And the first speaker will be you. And you are going to be, the title of your lecture is Personal Reflections of the Use of CBD for Arthritis, which you've already, kind of discussed. The second speaker is Dr. Prakash Nagarkati. He is the Vice President of Research at USC and has been doing cannabinoid research there for about 20 years now. And he will be discussing the use of cannabidiol in the treatment of inflammatory diseases, which is kind of his area of expertise. The next speaker is Dr. Mark Hammond, who's also with MUSC, and the title of his talk is The Cannabinoids, Practical Application as well as Limitations in Human Health. So I think that'll be particularly interesting. And then the final speaker for the conference is Dr. Lancer Scott, and he will be discussing, or the title of his talk is On the Front Line, CBD Use Amongst Emergency Patients and Its Impact on Emergency Care, which is something that, again, is, doctors, don't really know how to handle this situation. And certainly ER doctors are on the front lines every day treating patients who are having bad experiences. And, there's a whole range of issues that come up regarding cannabis in the ER. So I think that'll also be of interest.
Yeah, I think two of the three speakers I've heard speak before, and they're superb, the first two speakers. And I think all health professionals are going to be interested in all three talks, because so much of CBD is used by the public now. And I think sometimes the individual citizens are more educated about CBD than our healthcare professionals. So I think this is a great conference for healthcare professionals of all persuasions. I think the third talk particularly will be of interest to nurses, primary care physicians who are working in emergency settings. I think Dr. Hammond's talk about practical applications is a talk that, if it's similar to previous talks, it will cover a wide range of applications. And the first talk by Dr. Nagarkati is really going to talk about the mechanisms of actions and how this works, CBD works in the body, and really a very scientific talk, but down to earth at the same time.
Mm-hmm. Great. Well, I look forward to the conference, and I want to remind everyone too, just a little plug, if you will, that the MUSC annual update on medical cannabis conference will be Friday, January the 29th. That is the full day conference. Like you said, you guys have been doing it for a couple of years now. And I think the fact, again, that MUSC is taking up this topic in a very pragmatic way and providing, a broad range of information from various speakers, I think is tremendous. You guys and Harvard are the only two universities that I know of that actually do a CME accredited conference. I mean, there may be something in Maryland or Pennsylvania now, but I've not heard it. So I think that it's that this is really monumental that MUSC is really on the forefront of this topic, and that they're providing information that it's just, to me, it's invaluable. I mean, even if medical cannabis wasn't legal, let's be honest, there are people using marijuana every day that medical professionals come in contact with in their practice. And so having an understanding of cannabis and how it impacts the body is I think important. It's not something that, it's my understanding that it's not something that's typically discussed in medical school. So anyway, I applaud MUSC for taking up the topic, and Dr. Malcolm, for you joining us and sharing a little bit of a preview on next Friday's conference.
I look forward to seeing you, Bill, and everyone else at this good virtual conference next week.
Absolutely. Okay, well, thanks so much for joining us, and have a fantastic weekend, and we'll see you next week.
Bye-bye.
All right, bye-bye.